All right, we're back with another segment of ATS&J from 2023, and really excited to present Luis Torres here. Luis is a wonderful representation of areas when we're looking for ways for athletic trainers to enhance our impact beyond just the medical care we provide. Luis brought some really great information to help us do that through the research that he's doing with Montclair State. He's an assistant professor. Let me do it again. Restart. Welcome back to this next segment from ATS&J 2023, and really excited to present Luis Torres, who is bringing something outside of the realm of traditional medical application, but looking at those intangibles that help to make what we do better. Talking about depression and anxiety when it comes to sports, to athletes, its effect on sports rehabilitation, rehabilitation adherence, all those great things he was talking about in his talk at ATS&J, specifically focusing on the collegiate athletes, but there's a lot of applicable stuff in other realms. And so, thank you, Luis, for bringing this topic to the forefront. Luis is an assistant professor in the Department of Exercise Science and Physical Education at Montclair State University. And Luis, let's get right into your key points. You first talked about some research that you did and also that you looked into on the rate of depression and anxiety in athletics, and also research on rehab adherence. Tell us what you found with that in summary.
Definitely. And first and foremost, thank you for having me, Ryan. I really do appreciate it. So I think it's easy for us to forget that college athletes, which are obviously what most of my research is on at this point, they are also teenagers and young adults. So before we bring sport into the equation, we have to remember that by the nature of them being adolescents and young adults, they already have a heightened likelihood of getting some level of depressive and anxious symptomology. And specifically, I can share with you that one of the larger studies from the National Institute of Mental Health that came out in 2017, they claimed that about 46.3% of adolescents experience some type of mental health condition in their lifetime. That's nearly half. And of those half, you can say that of half of that 46.3%, they were considered severe mental health disorders. And within those severe mental health disorders, we have about 25% counting as anxiety disorders, and about 14% counting as various mood disorders, such as major depressive disorder. So we look at those numbers and we see that those numbers are high and scary even before we bring sports into the equation. So now let's talk about sports. When we talk about sports, specifically looking at a survey, one of the largest surveys again that came out from the NCAA, they've reported that between the years 2008 and 2012, 41% of male and 48% of female student athletes reported having either depressive or anxious symptomology. So all of these numbers really do paint a scary picture as to the kind of population that we serve, and how you mentioned we have to start looking at ways to help them as athletic trainers that expand not just physiologically, but also dive into the more psychological realms of care. And speaking specifically, when we look at rehabilitation adherence, we know that the more that a collegiate athlete or any patient can stick to the instructions provided by their healthcare provider, whether that be an athletic trainer, physical therapist, or a physician, the better outcomes they are going to have. So as healthcare providers, we should always be striving for 100% adherence. And when we have anything less than that, it's really problematic. And it's problematic because even if we do our best job and we come up with the best interventions, the best plans, we're not carrying out those plans to the best of their ability because our athletes, our patients are not sticking to the plan. And when we start looking at collegiate athletics in particular, in 2014, Granquist et al., Dr. Megan Granquist and her team of researchers over at Laverne University in California, they actually surveyed 479 collegiate athletic trainers that were representative of all division levels, years of experience, master's degrees, doctorate degrees, only bachelor's degrees, also looking at the different demographics as well. And all of them, almost all of them, 98.3% of them to be exact, reported that at some point, rehabilitation adherence was a problem. And they even claim that poor adherence was something that really plagued them on a weekly basis. And if we compare that study and we look at that value compared to some of the other studies that are out there, we really get a range in collegiate athletes where rehabilitation adherence has ranged anywhere between 40 to 90%. And that range is tremendous. And going back to my earlier point, that range is far too big for us to feel comfortable knowing that even the best healthcare providers out there are doing the best that they can to really help athletes achieve the best outcome that they possibly can. So, tying all of this together, we need to understand that the idea of rehab adherence is one that's multifaceted. And based on some things that I've done, some things that I've seen in my research, I really do feel as if us as healthcare providers, if we can get comfortable addressing sort of the psychosocial needs of our athletes, we can do a long way to hopefully bridging the gap and trying to get that rehab adherence closer to 100%.
And that range is huge for,
Yeah,
when it comes to rehab adherence. That's the difference between someone returning to sport, returning to a quality life as well. And I think it's you talked about how athletic trainers often feel limited in our ability to deal with these psychosocial aspects of injuries. Sometimes we don't know what to do, or we think we're doing the best we can. Sometimes it's just a matter of being more self-aware, but also being more in tune to these other myriad of factors that are impacting and elevating the risk of having post-injury depression and anxiety, or just depression or anxiety based on everything else going outside of their life and not just the injury. So as athletic trainers, we need to strive forward toward finding these interventions to identify those at-risk athletes. You talked about those ways that we can identify those in advance. What are some specific strategies athletic trainers can implement to activate and address this?
of course. And the idea of psychosocial issues in athletic training is not anything new. And I think what is interesting to realize is the fact that although it's not anything new, aside from surveillance testing, we really haven't moved the needle in terms of how we can fix this issue. So, for starters, I definitely think the first thing that is most important is for us to feel comfortable during our baseline preseason testing to really come up with a way to really assess baseline symptoms of specifically depression and anxiety. And I mentioned depression and anxiety, although there are a lot more mental health disorders out there, conditions, I should say. But depression and anxiety are the most important ones to look at because when we look at the research, we know that those two are the ones that most often come up as comorbidities in the collegiate athletic trainer or athlete population, excuse me.
Mhm.
And so, for starters, we really need to start implementing baseline testing, whether that is using a specific questionnaire, whether it's a paper questionnaire, or it's a questionnaire done electronically, or it's something that's embedded as part of the mandatory preseason paperwork. And that's really important because if you look at the most recent position statement in athletic training related to pre-participation physical examinations, which came out in 2014 by Conley et al. And those team of
Right.
researchers, it is suggested that you ask questions related to the general mental health well-being of the athlete in the preseason paperwork, but nowhere in that position statement isn't necessarily recommended for there to be a separate questionnaire for depression, for anxiety, or for both. And what I'm saying is that there really needs to be one, even if it's not one that's necessarily all that much longer, because that's what really allows us to get more accurate surveillance testing. And if we identify at risk athletes from the beginning, then now we jump in with our strengths of having a better referral network and we work with the counselor. We work with counseling and psychological services on campus. We work with sports psychologists. We work
Mhm.
with people that should be in our tool belt and we feel more comfortable starting that dialogue earlier as opposed to later when hopefully we can avoid something as a result of that taking place. So that's one recommendation that I definitely feel very strong about. Something else that I think is really important from a clinical lens is for us to start understanding that we really need to work on our psychosocial intervention skills. Psychosocial intervention skills as athletic training clinicians is nothing new as well. In fact, when you look at the accreditation standards of athletic training programs in the country, athletic trainers are expected to be competent in using psychosocial intervention tactics. But when you go out to the field and you start asking new and even some older athletic trainers about whether or not they use these skills, often they'll tell you they'll use strategies related to keeping injured athletes involved with their team or using short-term goal setting or creating variety in rehab exercises, but fewer of them use things such as imagery or effective motivation or realistic goal setting in some ways. So because of that, it's really a twofold situation where athletic trainers need to start trying some of these techniques. And when I say trying, obviously I mean looking at the research that's available, attempting to implement these things in their clinical practice with some patience, because unfortunately, like some of the more physiological interventions that we have, with psychosocial interventions, the impact isn't always seen or felt immediately. It's definitely something that athletic trainers need to be patient about. And aside from that, I think part of the continuing education piece of athletic training, which is so beautiful in my opinion, is that athletic trainers should feel a responsibility to further educate themselves on psychosocial interventions, whether that is attending conferences and listening to a conversation like the one I started, or attending other conferences, or taking CEU classes, or making a conscious effort to get involved in some trainings that really expose them to psychosocial interventions that maybe for some athletic trainers they've never used or don't feel comfortable using. And from my experience, athletic trainers are ones that are very much willing to try things. But for some, if they don't see the long-term wisdom or the rationale as to why they are willing to try those things, then they may not even consider them in the first place. So, twofold sort of solution I see here where surveillance testing needs to be enhanced, and also athletic trainers need to improve their knowledge and capability to perform psychosocial interventions.
And when you speak to that research, let's just wrap up by identifying what are those gaps? What must we still learn about, or how differently do we have to apply this research for the future to make this more all-encompassing to help us?
100%. So I think we need to start seeing psychosocial interventions used in all different types of populations. And when I say that, I'm obviously more so referring to athletic training populations because up until now, most of the research related to psychosocial interventions has been done by perhaps occupational therapists, physical therapists, sports psychologists, people that are able to work with patients in a more slowed down one-on-one setting, and they have the time to implement these interventions. So my onus, really, one of the things I'm most passionate about is bridging the gap between how do we take this high quality psychosocial intervention care and these techniques and start allowing athletic trainers in their traditional settings or at times non-traditional settings to feel comfortable using them. How do we find interventions that athletic trainers are comfortable using in a room of many athletes or in a situation where coaches are around as well as other sports medicine professionals? And I think that's what needs to be looked at. And for me, I'm exploring things such as perhaps virtual reality is the answer, perhaps some sort of, preloaded audio or video recording played in some sort of strategic fashion. That is the answer because we know athletic training can get very hectic, but at no time should that amount of how hectic something is start to compromise our care. And up until now, we've gotten very comfortable understanding that that applies to everything physiologically that the athlete might be feeling, but we need to have the same type of energy and focus when we start looking at psychosocial issues in the athlete. So the next step really is to start trying these different types of interventions. And from my experience, the effort needs to be not just for studies, but the effort needs to be in clinical practice for a prolonged period of time because I've met plenty of researchers who have done research on psychosocial interventions on athletes, and they say that those psychosocial interventions are really only done for the premise of the study or for the length of the study. And we're not really seeing what happens when those things actually begin to ingratiate themselves into true everyday clinical practice. And that's what I want to see. I want to see much longer studies, much longer case studies and case series, and really testimonies of how athletic trainers are able to comfortably intertwine all of these aspects of psychosocial intervention in their clinical practice.
I tell you what, it's exciting to know that we're thinking about this. It's exciting to know there's research on this because it's not just what you know, it's how you apply what you know.
Yeah.
And that's the difference maker that a lot of young professionals and seasoned professionals really discover throughout their career, is that, you've honed those skills and you learn those clinical skills, but you get to a point where there's other factors that come in for you to be able to be effective with that. So thank you for speaking to this topic, Luis. Your information, your contact info is in the show notes. We appreciate everything you're doing, and thank you for sharing the key takeaways from your ATS&J 2023 presentation.
Awesome. Thanks, Roz.
Awesome.
Pleasure to be a part of this.
You got it. Have a great day.
You too.